Hi everyone, I'm Nina. Welcome to the Mexicali Bariatric Center YouTube channel. Today I would like to talk to you about pre-op diets. As you know, we do several types of surgeries, and I'll start with the pre-op diet we ask our patients to do for the gastric sleeve and the lap band. They're very similar. For the gastric sleeve and lap band, we don't request an all-liquid diet. What we do is a high-protein, low-carb diet. Before we schedule the procedure, we ask patients to fill out a couple of medical forms so that the doctors can know more about them. These are reviewed by the internal medicine doctor and the surgeon, and they'll give a specific pre-op diet to each and every patient. But the most common is, like I said, a high-protein, low-carb diet. This is not a liquid diet for a period of 10 days to 2 weeks, depending on what the doctor sees on the forms, and the BMI, and if it's a previous surgery, and whatever they may find there. Now, there are some circumstances where we do get very high BMI patients. I'm talking 60, 70, 80 BMIs. And for those patients, we do a combination of liquid and solid diet. What I usually send over to patients is they start with a protein shake in the morning. They do one meal a day, and then they do a protein shake at night. And then they're able to have a couple of snacks during the day, like sugar-free Jello, for example. We also give them a target for protein a day. We give them a target, the maximum amount of carbs they can have a day. These are net carbs. And we give them a target for water intake a day. This is, like I said, for lap band and gastric sleeve. For the gastric bypass patients, the diet's a little bit different. Again, depending on the BMI, we might start off with a combination of liquid and solid diet. Let's say that a patient gets 2 weeks combination of liquid and solid diet, or a week, whatever the case may be. And then the last 3 days before surgery, sometimes it's 5, again, depending on the BMI and the complexity of the surgery, they get a 3-day liquid diet. In these cases, we do ask for an all-liquid diet for 3 days, and we give you a special guidelines for that part of the diet. As you know, with the gastric bypass, the intestines are manipulated, so the doctors need them to be in shape for surgery. Now, lastly, for the gastric, for the duodenal switch surgeries, that one, those ones, again, if we need a patient to lower their BMIs, we start with a period of combination of solid and liquid diet, let's say another 2 weeks. And then the last 5 days before surgery, we do the all-liquid diet. We get some patients that have very high BMIs, and that one, the amount of combination diet might be longer. The last 5 days are always what the doctor requests. We also give them a list of foods to avoid during a week or 2 before surgery. That might, kind of fit into the pre-op diet, but we need them to avoid certain things. Now, we get asked a lot from patients, what happens if I want to do it for a longer time? That's perfectly fine. The longer you do it for, the better. Your risk will be reduced, your liver will shrink more, so it is good. But it is very important for you to be realistic. If we're asking for a two-week pre-op diet, and you want to do it for 4, that's fine, but make sure that those 2 weeks before surgery, you are extra strict. Please don't cheat, don't kind of bend the rules, follow it very strictly for those 2 weeks before your surgery or the time that we require. Those are what the doctor is more concerned with. Okay, I hope this helps, and I hope to see you soon. Bye-bye.